Today is a little bit more out of my experience. So everything I tell you today or talk about, um, it's certainly not an overarching statement. All the things we talk about today will be up for debate, and there will always be exceptions to some of the concepts. So it's more about sort of opening up the philosophical conversation about, um, you know, how do I understand the process of co-recovery, and how do I delineate what is a supportive behavior from what is an enabling behavior. So, oh, beautiful aspen trees. So I am able to see the chat box, so you know, just so you know, but I can't see the question and answer box. So just a quick sort of backtrack from last month. I really wanted to just go through a quick review of sort of this progression um, from the literature regarding attachment and codependency and kind of the school of thought as it developed. So Charles Darwin was the first one to really describe that survival instinct in animals, of course, in The Descent of Man, 1871. And then Bowlby comes along in the 50s and 60s, and he starts doing the most famously strange situation experiments, where he identified protest, despondence, and detachment as survival skills, and starts developing his theory of attachment. A few years later, in 77, Bandura, which is interesting because this social learning theory came out in concert with another psychiatric article that was the first article to put the term biopsychosocial in one sentence. So he described this social learning experience and how we learn through the social relationship. So really describing that nature versus nurture situation, that we use our social learning as survival skills through that herding instinct that Darwin had talked about before. And then Janet Woititz comes out in 83, starts to describe through her experience that she starts to identify traits in people that have similar upbringings, and starts to talk about traits of adult children of alcoholics and how they do have a tendency to display these codependent traits that we talked about before. And then, of course, Melody Beatty comes out in 86, and she coins the term codependency, is one who has let another's behavior affect, I should say, him or her. Hey, that's why I like being in this mode. I'll just correct it as we go, my little typos.
Edit on the fly.
One who has let another's behavior affect him or her, and who is obsessed with controlling that person's behavior. So what does a codependent person try to control? They try to control their environment and the people around them so that they can feel safe. That's the essential basis of the whole thing. Then, of course, Pia Melody comes along in 89 and talks about developing a clinical process for understanding codependent traits, and she further defines things. One of those is that codependents have a hard time expressing their reality. They're either all or nothing, things like that. And then Melody Beatty comes out again, and she sort of redefines her definition. And one of the things she says in this book that I really loved is that it's codependency sometimes can be parental strengths overdone, or parental instincts overdone. So I overlove, I overhelp, I over problem solve, that kind of stuff. And then she was the one that also said codependents tend to be super achievers. Instead of, she thought overachievers was demeaning, so she said no, they're super achievers. And if you have ever seen either yourself or somebody else with an addictive person in their, or an addicted person in their life, the level that they will go to, the length that they will go to try to solve that person's addiction is astounding. So she calls them super achievers. And then, of course, Susan Johnson comes back in 2019, and this is a great book. which actually I have not finished yet, but this is a fabulous book on emotionally focused therapy and working on the process of treating attachment disorder. So just a quick history. So the question is, how does a person change? And in 1994 and before, well, 1994 is actually the book Changing for Good. The Stages of Change model came out in the mid 80s, and Prochaska and DiClemente actually were researching cigarette smoking. They were trying to figure out how people quit cigarettes. And so through that, or quit nicotine more specifically. And so they found 6 stages, and normally you'll see this in a pie chart: pre-contemplation, contemplation, preparation, action, maintenance, relapse. And then the internalization is where a person actually exits the model because they've learned the new behavior and they don't have to be hyper aware of maintaining the change. So briefly, and I put a blank in here because when people talk about change or we're talking about addiction, normally people will think, okay, pre-contemplation. So if I'm pre-contemplative, I actually don't see, or I'm not even aware that I have a problem with my, usually people will put drinking in there or using drugs. I leave it blank because just like the 12 steps of AA, you can just replace the word alcohol with anything you want and do that model around that. But if sometimes there's a person and they just are not aware that there is a problem there. And so it is kind of an issue of ownership and self-reflection. So one of the traits of somebody in pre-contemplation is denial. And maybe they don't want to see that there's a problem, because if they do acknowledge there's a problem, then they'll see that they have to do something about it. And if they're not ready to do anything about it, then they'll just keep themselves in this pre-contemplative state. So as a person moves around this pie chart model, they sort of eventually evolve, I guess is the word I'm looking for, into a place of contemplation where a person might say, maybe I need to change my blank. Here we're talking about codependency, so maybe I need to change my codependent traits or my attachment traits. And this is where a person isn't really doing anything yet, but they're actually just thinking, okay, this could be a problem. You know, most drinkers, I just use alcohol because it's the easiest example, by the way. There's many examples. But somebody wakes up with a hangover and they're like, oh, wow, this is a problem. Maybe I need to change my drinking because I don't like the way this is turning out. I haven't done anything about it. People will then evolve into a place, and this is kind of where people get hung up, is they will say, maybe I need to change my drinking, for example, and then they'll say, oh, I'm going to stop tomorrow. And they skip over this immensely important stage, the preparation stage. Some people call this determination or planning. So there's different sort of lenses for this third stage of change. But when people don't actually plan on how they're going to change, they're almost always destined to fail. Is this more of a lay person's training? Potentially, yes. I try to make things so that it's understandable, as inaccessible as possible to everyone. Thanks for the question, Peter. So, so how can I change my codependent traits? How can I change my drinking? So I have to do a little preparation and planning about what is it going to be like when I don't do this behavior. And if you think about codependency, a lot of the traits of codependency are dealing with some form of trauma, some level of trauma. So if a person has found a way to deal with their trauma through controlling other people, or a person who has tried to stop their drinking, without actually thinking about what it's going to be like, because or they're a drinker because they've had a trauma, so they use that drinking pattern to change uh, their experience of the trauma or decrease it. When you actually start thinking about changing that behavior, it becomes pretty drastically difficult. Um, so this preparation stage is extremely important to think about. What is it going to be like when I change my language with my addict? What is it going to be like when I um, change the way I help my addict, the way I love my addict, the way I problem solve with my addict? All of those things need to be thought about pretty deeply, and before the person actually goes into action and says, "Okay, I'm gonna do something different starting tomorrow." The action stage eventually morphs into the maintenance stage, which is where some things are working. It's working for me, and I'm going to stick with the things I'm doing. For example, um, to me, this is actually the most dangerous place, because in the maintenance stage is where people usually get bored. And so, if you ask an addict who's been sober for 6 or 8 months, and they say, hey, I'm looking good, I'm feeling good, what do I do now? And their sponsor or their therapist says, well, do the same thing you've been doing. And that's not great news, because I don't like doing the same thing over and over. I need to be excited. And so it's actually can be for some people a very difficult place to be in maintenance. Um, Relapse, and I talk a little bit about relapse because a lot of people always associate or typically associate relapse with alcohol or drugs. Relapse is just returning to a behavior that I had previously stated was not good for me or that I wanted to change. Going back to that behavior, that stated behavior, is what the relapse is. The word relapse gets associated, of course, with alcoholism and with drug addiction, but a relapse is going back to the behavior. So if I'm a workaholic, I go back to working too much. If I get stressed out, if I'm an alcoholic, I go back to drinking. If I'm an addict, I go back to my drug of choice. If I'm codependent, I go back to problem solving for my addict. So you can see as we go down, it becomes a little bit of uh, uh, it's not as black and white for people who kind of try to work on this codependency thing than it is for an addict. And it's simply because an addict, really, it's black and white. If they're either using or they're not using, right? And if a codependent is trying to say, I'm not going to enable my addict anymore, well, how do I figure that out? Because it's not just a black and white thing, because the behavior that I did yesterday that was supportive might turn into an enabling behavior today. So it's a little more of a tenuous situation to figure out what those things are. And that's kind of what this is about. Um, so, oh, and just real quick, there's a great book, this book here called Changing for Good. I have it at my other office. Changing for Good is a great little book for kind of working through these stages of change and understanding how it's a trans-theoretical model, they call it. So that Changing for Good book is kind of old, but it is very informative and helpful. It has been for me. So, so as I move forward, we kind of look at this idea of how does change happen and how are people encouraged to change? And so there is this idea that there needs to be a balance of um, challenge and support. I'm reading Jody's. It helps to review Prochaska and Clemente to consider the fuzzy lines. Trying to control my people. Yeah, thanks, Jody. It's every time I go through this, I kind of have a new realization. Like I can tell you, I've watched Pleasure Unwoven, if you know what that is, probably 100 times, and I always see something new. Um, and honestly, along with what Jody said, that it's good for me to go over this and remind myself of it. So we always talked about when I was at CSU working in the day programs, and we had this program called Back on Track, and it was for students who were really in trouble with the conduct system. And so we talked about this idea of challenge and support, and that there needs to be a balance, and the support must match the challenge. If there's too much challenge and not enough support, growth can't happen. And the same in contrast, if there's too much support and not enough challenge, that's not good either. And so for when you're working with yourself or with someone else, for example, we talked about that planning stage. I have to remember that my behaviors to solve my trauma and my anxiety and my survival traits, my survival instincts, those are things that I've done from a very young age. And so to think about changing them in one day is actually unrealistic. So that's quite a challenge to expect myself to be perfect of changing these behaviors. That's why alcoholics and addicts have such a hard time, because, you know, they always say relapse is part of the process. But relapse is part of the change process, not just the addiction recovery process. Right? It happens to everybody. Like, if you just think about it, uh, people decide, I'm going to exercise every day. But when they don't exercise for a day, they don't see that as a relapse. They say they're not going to eat fat, or maybe they're not going to eat sugar. And then they splurge on a cookie, but they don't really see that as a relapse. But it's really the same process. So if I say I'm not going to eat sugar, and 3 days later I have a piece of cake, obviously that was too much of a challenge for me, and I didn't have enough support. And so I'm always thinking about this balance. How can I, and I think about this when I'm working with other people, but I also think about it with myself. Am I challenging myself? Is this too much to expect of myself? What support do I have around this? Um, uh, you know, if I use the sugar thing, like, it's kind of like the same recovery process. Does anybody else know that I'm trying to, like, work on not having sugar? Um, that might be a supportive behavior to do. And in kind, when I'm working with somebody else, I, as a therapist, as a clinician, I try to challenge somebody up to a point where I don't activate their fear response, because that's when a person goes into a place where they're not really doing anything. They're not growing or changing. They're just defending and surviving. So as a therapist, I try to give them encouragement and support and balance that with enough challenge so that they continue to move forward, if that makes sense. So this stages of change and this challenge versus support idea are two things that are very much always in the front of my mind when I'm working with somebody. And I try to teach it to people as much as I can, because I think that lay people need to know this stuff. And not that it's the end all be all, but it's certainly a great tool to have. So if we keep that in mind, here's some ideas that I put together. And for example, what happens to a person if there's too much challenge and not enough support? Well, usually one of the first things that happens is they start to have a low self-efficacy. Low self-efficacy is the belief, self-efficacy is the belief in a person, in themselves, that is, that they can accomplish a task. I have high self-efficacy that I can finish this talk today. I have moderate efficacy of how well it's going to be. No, I have pretty high self-efficacy. But when a person has too much challenge and not enough support, their self-efficacy starts to decrease. And then they start to have little belief that they can actually accomplish the task, right? And so with that comes low self-esteem and a loss in confidence. And then, like, if you can imagine somebody asking you, I don't know if there's any mathematicians here, but I always say, can you recite the quadratic equation? Which, don't ask me to, because I can't do that. But if I just said out loud, write the quadratic equation out, a person might become really frustrated if they can't pull that out of their memory. And then they might get defensive because they think that they are being singled out because they can't do it. Now, I'm not giving them much support. I'm just telling them to write it down, right? So they get frustrated, and then of course the person will lose interest if they can't solve the problem, and then they'll decrease their effort due to the belief that their effort will not be sufficient to complete the task. They'll just give up. I'm not good enough to do this anyway, so forget about it. and then eventually they withdraw from the task. So in contrast, what happens if there's too much support and not enough challenge? Um, and this is kind of what a codependent person might do. They would glom on to somebody and they would just over support them. And if you look, and like I said, these things are debatable, but I propose that the same thing happens when somebody has too much support. They also have an experience of low self-efficacy, and they lose motivation to accomplish the task because they don't actually have to do anything to get the task accomplished. It's done for them. And I use this example of uh, uh, of teaching a kid to ride a bike, and I'll go through some of these before I tell you about that. But low self-esteem, they start to lose confidence that they can actually solve the problem by themselves because they're just overhelped. There's no challenge for them to actually do anything. Um, Feeling of being smothered. And then, of course, you can see a lot of it's the same: frustration, boredom, loss of interest. And then they'll just decrease their effort due to the belief their effort is not necessary to accomplish the task. It'll just get done for me, so why should I put any effort? And they'll eventually withdraw from the task. But I use this example of teaching a kid to ride a bike, and I just know because I still have a memory of my dad, holding the sissy bar on my bicycle, and and learning to go from a tricycle to a training wheels with two-wheeler, and then one training wheel, and then all of a sudden the parents take the training wheels off and they start running behind the bike and they start trying to teach the kiddo how to ride on their own. But sometimes people have a hard time letting go of the sissy bar, and this is kind of like my metaphor for codependency. And if you ask yourself, what happens when I'm supporting this kiddo who's trying to learn how to ride a bike and I don't let go of the sissy bar? And so first I think about the motivations for why doesn't the person want to let go? And so some of those might be, I don't want to let go because I know that when I let go, the kiddo will fall and I will be forced to watch my child be hurt. And so I hold on to the sissy bar to protect myself from that trauma. So I continue to hold. But I do it under the guise that I'm supporting them. They don't know how to do it yet, so I'm not going to let go yet. But there are other things that are happening in this process, and it's sort of this idea later that'll come out of learned helplessness, is that I send messages when I don't let that person try to ride the bike on their own. And I send the message that I don't think they can do it by themselves. I send them the message that I don't think they know how to do it by themselves. And there's even a more insidious message that I don't believe they can do it by themselves. And so then that person potentially could start to have this idea of learned helplessness, and they'll think, well, I'll never be able to do this on my own. And so what that does is create this enmeshed relationship between a parent and a child. So instead of getting the child to learn on their own and the parent being willing to watch the kiddo have a fall, they sort of treat them into this enmeshed relationship of learned helplessness. And I know that's just a metaphor, but it's just an idea to think about of when I'm trying to sort out, when am I over supporting? And why am I continuing to over support? And when is it okay for me to let that person, and I say this very carefully, but the families that I work with, sometimes I encourage them to allow their loved ones to enjoy the consequences of their choices, good or bad. And because if they fall, they could enjoy the task of learning how to get up. And if they ride the bike, they can enjoy the task of actually accomplishing the task. So either way, they hand the ball to the person, and that person gets to celebrate the failure or the success, right? And so it's this very insidious kind of message that gets sent when people continue to overhelp and over problem solve, and they do it under the guise that they're trying to help the other person. But in the process, they're not really doing it to help the other person. They're doing it so they don't have to watch the other person hurt. And by the way, we're talking about addiction, so watching the other person hurt could be a fairly drastic situation. So part of that is valid, so I don't want to undercut You know, I don't want to diminish the gravity of that. But some people believe that if they stop helping, that the person might not make it. And sometimes that's true, and many times it's not. So I kind of say that with a, uh, you know, I say it with caution, right? Um, so here's the balanced challenge and support. So hopefully, if I let go of the sissy bar and they fall down, and then I can teach the kiddo how to get back up, right? And something I wrote a few weeks ago is I only have to get back up one more time that I fall down. And so in that, they learn their own increased self-efficacy. They increase their self-esteem and confidence. You know, I rode the bike 10 feet before, now I'm riding it 20 feet. Now I can ride it forever, and I don't fall down. The feeling of being encouraged and supported, but not enabled. And so I want to send the message essentially that and I say this to my clients quite often, you know, like, I know you know what to do. And that's the truth. People know what to do. Um, Sometimes the challenge of doing what they know is just too much, and that's where they need the support. So hopefully, if the challenge and support is balanced, they increase the motivation, they increase their effort, um, and they become more self-directed, because that's really our job as parents anyway, um, is to help our kiddos differentiate from us and be more self-directed, and of course enter society under their own power. Um, and I know I'm using a parent-child kind of example here, but this could be a husband-wife, wife-husband, you know, grandparent, grandson. It could be any combination of people. I just use the parent-child with the bicycle because it's for me it's an easy metaphor to sort of get. So then they experience a gradual success in accomplishing a task. And oh my God, if just think about how you feel when you accomplish a task due to your own effort. You know, one of the last big things I did was I finished a doctorate and dissertation, and that was a definite gradual, um, uh, a number of gradual small successes in order to get that designation, and it felt great at the end. Um, but because I know that I did it one little piece at a time, and I did it with people's help, but I did it by asking for people's help. And so this is kind of one of the other things, and we'll sort of get to that. So no questions?
Feel free to submit questions as they come up. We can answer them
Yeah.
throughout the presentation as well.
So yeah, this is the last slide before we really get into those other things. But you know, it's identified in the literature, you know, both parties in a relationship need to look at their early relationships and how those relationships influence their current relationship with themselves, with their behavior, and with their loved ones. And then, of course, a little quote from the codependency text. All healthy relationships require consistent time, patience, attention, and nurturing. And then, um, and we have to make an effort to recognize and evolve our relationship with our loved one from a parent-child. And this is coming strictly from a transactional analysis kind of lens, because it's also something that's easy for me to get. It's easy for me to understand what a parent-child relationship is and what an adult-adult relationship is. And when we're talking about a parent with a child addict, um, or even just a parent-child, I mean, you can think it's very difficult if you have adult children. There was a transition process that happened when they became young adults, and your relationship evolved from one of being a parent-child to an adult-adult. And that's kind of what this whole enabling, supporting conversation is about. And codependency and attachment are rooted in prior survival mechanisms learned early in life in order to cope with some level of trauma one might have experienced in the past. So a lot of these codependent traits are ways that I strategize and cope with my traumas, and they're essentially survival skills. And people have different levels of trauma, but a lot of this can be rooted in traumatic situations. For example, last week or last month, we talked about the kiddo that grew up with an absent mom, or an absent dad, or a dad who a dad whose behavior was unpredictable. That's fairly traumatic for a kiddo. So
could you, could you elaborate a little bit on a high level of what you define co-recovery as? I think this is a really important point. In I know in my personal experience, I definitely, and we talked about this, it's like pointing the finger. It's like, oh, it's their problem, and like almost the shame and anger piece, until I became to the acceptance of like, oh yeah, this is about me too, and how I'm interacting in it. Could you just, my question is, could you just define co-recovery? Because I think that's a really good term that really stuck home with me.
I don't know if I'm the only person to think of it, but it just came to me one day. I'm sure it's been said before, but it's just this idea that people tend to see addicts as being the person that needs to recover. And I propose that that's not true, that the families need to recover too. And they need to recover from their belief of or need to control their addict. So a lot of people will say an addict is addicted to their drugs and a codependent is addicted to their addict. And they both need to have this idea of co-recovery. So if you think of challenge and support, also the way that needs to be balanced, this recovery process also needs to be balanced. So a person who's in recovery from addiction, say, and a person who has codependency but is in denial of it, when that addict starts to get better, they will actually start to draw boundaries with their codependent loved one. And that will make the codependent uncomfortable. And in contrast, if a codependent gets better and the addict stays sick, they will start to draw boundaries and start to change their language, et cetera, in communication. And then the addict will get uncomfortable. So in this whole idea of the recovery realm, whoever gets better, the other person starts to feel uncomfortable in that process. And then at that point, they have a choice to do something about it or not. So for me, both parties, all parties, need to do this self-reflection, and not a critical self-reflection, but a compassionate self-reflection to say, okay, and essentially, what's my play in this? What's my part in this? What part am I playing in this whole thing? Where did I overhelp this person into a place where they could not differentiate from me? So if I do that self-reflection compassionately, and basically this is the AlAnon and codependency work that's either in the 12-step CODA program, or it's in the Melody Beatty Facing Recovery workbook, or some of the things that Melody Beatty talks about. Did I say Melody Beatty? Pia Melody with Facing Codependent workbook, and Melody Beatty with the Codependent No More. But it's really this idea that both parties have to have this idea that I have work to do too. And if you think about it for a minute, and I ask this question to many family members, and I will ask the family member, what can your loved one do? Or what I'll ask them is, how would you feel if your addict stopped using? And they would say, I'd feel fabulous. And then I asked the addict person, and I would say, what if your loved one stopped enabling you? And they say, oh, I would be great. And more specifically, I would ask them, how would you feel if your loved one was taking care of themselves? And both parties will say that would be great if they would take care of themselves. And honestly, sometimes it's much harder for me to convince somebody who is in this codependent world, this attachment world, to get help through CODA or adult children of alcoholics or a private therapist or whatever. It's much harder to do that than it is to get an addict to go to treatment, because their disease is a little more insidious. Was I going to say something specific as it relates to trauma recovery from growing up in an unpredictable childhood? I was thinking how it complicates therapy efforts, but it was something else you planned. But was there something else you plan to say about it, such as attachment styles? Probably not today, but I really believe, Jody, that those traumatic childhood experiences are kind of confusing in a couple of ways. One is that the child actually to a certain point believes that those things are normal. That becomes their normal. And so when they see other families acting differently, they're sort of surprised, and then they start to self-deprecate in a way when they start to realize that things could be different. But when people experience trauma of any level in their past, um, and people who experience trauma actually sometimes they'll say, oh well, my trauma wasn't as bad as theirs, or I have a lot more trauma than that person. Trauma is not really comparable between people. A person has a trauma experience and it's their experience and theirs alone. And so I need to not compare what's worse or better in that trauma behavior. But as far as trauma goes, that trauma tends to affect my decision making ongoing. So when that trauma is happening, the first thing I try to figure out how to do is to um, relieve it, right? Relieve the pain. Um, a lot of times you will hear people, one of the common things that happens is dissociation. So where a person, and you've probably read stories about women who have been attacked sexually and raped and such, and that they have this experience of dissociation and this really traumatic and unthinkable process. And so then they take that trait of dissociation and it comes forward into their present world. And so in a way, it becomes part of that coping strategy arsenal that we all grow up with. Like we all have those things that we do to cope with whatever is causing us trauma or a memory of our trauma or anxiety, right? So I don't know if that totally answers your question, Jody, but those are kind of like my initial thoughts on the trauma piece. But
We had, oh, sorry, go ahead.
that's okay.
We had two more questions come in. So one says, would you suggest that you tell your addict son that I have work to do as well? So is the person in co-recovery or the recovering codependent, do you recommend openly talking about that with the addict?
That's a great question. So that person, I would say, think about how you would feel if your addict came to you and said, hey, I've got some things to work on. If I had a struggling addict in my life and they came to me and said, hey, I've got some things to work on, that would be super encouraging for me. And so if I came up to the addict and said, hey, look, I've realized I've got some things to work on, I would take, as an addict myself, that would be great news for me. So I encourage like a gradual, as open a conversation as you're comfortable with. And it's kind of like balancing that thing between saying too much and not enough, because what this person is asking is, what's my part and what's their part? Like my stuff that I need to work on, that's my part. Whatever your stuff is, that's your part to figure out and take care of. And maybe you go work on your part a while, I'll go work on my part a while, and then we'll come back together. So that, yeah, I definitely encourage. And sometimes a person or a couple will need, when I do marriage and family sort of conjoint sessions, I will sometimes ask, I don't always get what I ask for, but I would ask that they both sort of have this recovery process for 3 to 6 months before we come back together as a couple and talk. But yeah, I always encourage an open conversation.
Awesome. The other question is, and sorry, I don't want to cut you off from moving through, but the other one is just explain what disassociation is, or dissociation. Sorry.
Dissociation is kind of when a person goes, and I think that a person sort of goes to another place, so they don't actually have a memory of what's going on, so they dissociate. And I know that's a very simple explanation, but it's sort of a compartmentalizing of your memory of that trauma. So some people could dissociate for hours at a time, and then they don't have a memory of what happened. So they're there physically, but they're not there. They're someplace else in their mind. And so that's definitely a strategy for people who are experiencing high levels of trauma. And, you can see that in, veterans coming home that have experienced really difficult things. you know, rape victims, assault victims, domestic violence, all of that stuff. People can learn that trait of dissociation in order to cope with things. So if I try to tease out a little bit in the next few minutes, you know, so enabling behaviors, this is just my collection. Enabling people avoid conflict. They deny the seriousness of a problem. Oh, it's all okay. They compartmentalize emotions. They stuff things away and say they're okay as long as I'm taking care of my addict. They're critical, they're blaming, judgmental, rescuing when the person doesn't need rescuing. And this is kind of where the two traits sort of get, when is it rescuing and when is it supporting is a great question. So blurred boundaries, conditional love. I love you, but you're still using. And last week we talked about the Love First book that is more like, I love you and you're using, which is unconditional love. And so another enabling behavior is providing support when support is not necessary, and actions that make it easier for that person to continue their self-destructive behavior, like giving them rent when they have spent it on drugs, instead of allowing them to experience the consequence of not being able to pay your rent with a landlord. And things that, which is also, that's something that encourages this enmeshment. So this unhealthy attachment between the caregiver and the caretaker, or that's funny. The taker of care.
Wouldn't a
So,
person who is critical, judgmental, blames think that they are not enabling by being that way? That's the question.
well, they blame the problem on the person, right? They're judgmental of the person. It's not a supportive behavior to tell people you're no good over and over and over again, and blame them and criticize them. And partially that's because most addicts are pretty blaming and critical of themselves anyway, just like codependent people are. They're very critical of themselves, right? One of those traits from Waititz, they're brutally self-judgmental, right? So that's not an unusual trait. So supportive behaviors, honesty, authenticity, respect, being trustworthy, being loyal, being non-judgmental, accepting, loving detachment. That's a piece that came from, that's kind of like an AlAnon sort of phrase, I guess. I can love this person and still detach from them. I can love you from a distance. Because I'm not being involved in your life doesn't mean I don't love you, right? Having healthy boundaries, that's an entirely other topic. Encourages individuation and differentiation. And so this is the thing that the codependent person, the severe codependent, I would say, does not want. I don't want my addict to individuate from me, because if they don't need me anymore, what will my job now be? And I know that's kind of oversimplifying things, but our job as parents and friends and lovers and couples is to have a healthy relationship where we have a relationship together, but we also have an individual identity apart from that person. And so, and a supportive behavior provides support when support is necessary, which is also not always a clear line. So I'm going to go down. I have two slides here with some sort of matching pairs of avoiding and enabling. And again, this is just from my collection. Again, enabling is avoiding things, not wanting to talk about things. Supporting is being present and listen. Supporting is treating the relative as a whole human being instead of seeing them as a diagnosis. And this is part of the idea of separating, and you'll hear this a lot from in the recovery world. I need to separate the behavior from the person. So just because people are acting badly doesn't mean we have bad actors. That's what Kevin McCauley says in Pleasure Unwoven, meaning people who are using or drinking might do bad things. That doesn't mean they're bad people. It means that the addiction has taken over and caused them to go against their moral code. So when I see that person as a diagnosis instead of a person, it's hard for me to actually be supportive in that. So separating the behavior from the person, having a sense of hope that they can recover instead of a feeling of hopelessness and despair, which I know that's a hard ask for people that has watched somebody relapse over and over and over again. Back to fostering individuation, building on their strengths. And so this is kind of straight out of a career development sort of idea, is strength-based job searching. So build on their strength instead of focusing on what the problem is. So a lot of times in the recovery rooms, you will hear people say, I'm either sharing in the solution, or I'm living in the solution, or I'm sharing or living in the problem. And so the person who is working on this supportive behavior is living in the solution, which is all of these things sort of put together. And I need to live in the solution. I need to support their freedom to fail, which is part of the solution. I need to allow them to carry the ball, allow them to make decisions and experience their own level of failure or success. Because then if they're carrying the ball, they get to carry the responsibility of the success as well as the failure, right? And there's nobody there to sort of overshadow the experience. Taking care of yourself instead of allowing the mental health and addiction issues to consume your life. So I don't know how many times I've heard of people being on the internet for hours and hours and all night trying to find the right treatment center or counselor or whatever for their therapist, or for their loved one, that is, trying to find the solution for them. And finding that solution is their job. The codependent's job is to find the solution for their codependency, right? So here's a few others. Developing appropriate boundaries and then actually setting those boundaries. So this is kind of preparation and then action in order. So I can't just set the boundary. I have to develop what would be appropriate and gradually set these boundaries instead of sort of dropping the hammer and doing them all at once. And the enabling piece would be allowing those boundaries to be broken. So it's sort of like, if I set a boundary, I have to be willing to hold it. And if I don't hold the boundary, then I'm not acting in a trustworthy way. And so the addict will use that against me. Well, you said I couldn't do this, and then I went and did it, and nothing happened, you know?
This is a good question. And I think we talked about this and probably related to boundaries, but what if their bad decision affects you and your child? So the addict's decisions are affecting your life in a negative way. We just talked about this yesterday, actually.
You and so like say a wife and a baby kind of thing.
Yeah, it seems like that. Yeah. What if their bad decisions affect you and your child?
Yeah, that's a great question too, because then you have choices, because now you get between a rock and a hard place, because if you're depending on that person for income, but now they're not providing the income, now you and the child are not safe, and so you have two people's safety to worry about. So then you get to make that decision to solve the problem, and there's not really a good way to solve it, you know. That person is affecting the safety of the child, then that to me becomes a pretty easy decision to make. However, it's not that black and white, right? I mean, when, you know, it's hard to pull a kiddo away from, say, their dad. It's hard to make that decision. But when it comes down to a real safety issue, that's where people sort of get inured into staying in the relationship, and then they pull up those trauma solutions to cope with it, and they just deal with it. And then the more they deal with it, the more they get stuck in that codependent cycle, and the person's behavior continues to get enabled because say the wife or the baby never leaves, the wife or the kiddo never gets pulled away, so there's no consequence for what they're doing. But that's a tough ask too, because now you're talking about resources and, what am I going to do? How am I going to pay bills? And then there's the emotional problem of separating a kiddo from their dad, say in this particular example. So it does become a very difficult decision-making process of setting those boundaries. And so that's where a person, would be helped by places like Crossroads or Al-Anon or Codependence Anonymous or Alcoa, the adult children of alcoholics, like having a sponsor or somebody you trust in those areas or a therapist in those areas to help make healthy decisions for yourself, to gradually get yourself out of a really dangerous situation. That's a really tough question and a really horrible situation for somebody to be in. And that really makes the recovery, it kind of convolutes the whole thing, because now you have the safety of a kiddo at stake as well as your own.
Yeah, and we are going to have a full session on boundaries as well. Someone said hard to find a sponsor online right now.
I know.
Yeah, if you want, feel free to reach out to me and I can help as well, in any individual. I know there's a lot of online AlAnon meetings, so feel free to reach out to me.
Yeah, this current situation, and I didn't say anything, but I hope everybody's staying healthy in the C19 era. It does, this, it's kind of weird because when we first started doing this webinar was kind of semi-new to me, and now it's just sort of old hat because I've been doing like webinar style meetings forever, it seems like. But it does make it hard to find somebody viable. But reaching out to the community wherever you're at, and calling the Al-Anon, the AA central office or the Al-Anon central office, there's usually a touchstone person there that can sort of maybe at least put you in contact by phone with somebody that you could start that process. But it is tough. Making choices that are in your interest. I'm just going to follow these down. Being willing to say no. And rebuilding your own identity independent of the other instead of defining your identity based on the other. I see the question from Jane coming in, but I'll really quickly just say, when I ask a codependent how they're doing, they'll say, oh, my addict's fine, I'm doing good, or my addict's using, I'm not doing so good. So trying to have that independent identity being built is super important. And that's how you differentiate from them, right? So up till now, I was talking about differentiating the addict or the kiddo from the parent. And now the parent also has to do that differentiation process, that individuation. And Jane says, how do you be supportive when severe alcoholic doesn't trust other people to consider therapy? Could you be a little more specific, Jane? So what I'm getting is that there's somebody who's a really severe alcoholic and they just don't trust anybody and they won't consider therapy. Not to sound harsh, or are there any support groups for people of adult children?
That's a different.
Yeah, that's it. Yeah, that's a different thread.
So yeah, she means when they're not
doing anything. Alcoholic who's not doing anything and they're not willing to do therapy. That's somebody who is in the pre-contemplation stage. And so if they're not willing to move through those stages of change, then I have to make decisions based on that behavior, right? Somebody raised their hand a minute ago and I missed it. Was it Carla?
There's one more. Are there any support groups for parents of adult children who have dual diagnosis?
The main one I would know there would be NAMI. But I want to go back to this, just this question about that Jane had, because, and it's kind of akin to the question about the destructive a person that's putting a kiddo in danger and somebody else's well-being in danger. It's the same kind of thing is happening with this question from Jane about how do you be supportive. And so that support might look like loving detachment. I love you and I cannot be in your life this way. And I say that out loud, and I just know that it's, when it's somebody that you love or in love with, and then here's a person that's just reading a question on a discussion board and saying, your supportive behavior might be to let them experience the consequences of their behavior. And if they're not willing to get help, one of those consequences might be that you have to remove yourself from that situation, from that relationship, at least for the time being. Also a really difficult situation.
This one says, the family group of AlAnon can be good with adult children with dual diagnosis. So someone's providing support with the dual diagnosis question.
Yeah, thank you. From my experience, for example, in AA, there are people, they mainly focus on alcohol, but there are people in there these days with an array of addictions. And the same thing I think that this person is pointing out is that in AlAnon, if you go to enough meetings, you'll find somebody who has struggled with a dual diagnosis behavior. And really, it's about sort of finding your own community. Not every person in AA becomes somebody that is part of my inner circle. However, from going over the years, I found 5 or 10 people that I really love and respect and rely on. And so that's kind of the process of developing that chosen family in this co-recovery process. One person said, great information, boundaries are tough, even when you're a therapist and a mother. I thank you, and I look forward to next month, and it is 7:04. So I know that was a lot, and I hope it was helpful. Thank you for the people that are still here. I know we went a little bit over time, but any questions or comments that we haven't seen or had? Oh, there's one new message here that I didn't see.
Oh, it just says thank you.
Oh yeah, and NAMI, yeah, somebody else mentioned NAMI. So that's the resource for people with mental health disorders. It's the resource for people with loved ones who have mental health disorders.
Yeah. Also, for those that are here, we are going to do another hour-long session next month on Tuesday, May 26th at the same time. So you'll get an email with a link to register for next month too.
Thank you for the compliment, Peter. Appreciate that. Sarah, when will I get a notice on each meeting? And yeah, so
yep, we'll follow up with an email tomorrow with the recording from today, and then the link to register for next month too.
And I'm sure, Megan, if you have other questions, I'll do my best to answer them as quickly as possible if there's something that we didn't talk about. But I really, is it all right to come back? Yes, absolutely. Many times people say that, like, oh, I wish everybody could do the 12 steps, or everybody should go to therapy, or everybody should. I think these things are, they're focused in this one area today with codependency, but these concepts are not, they're not specific to this. I mean, I think they're good for everybody to think about. And so, yeah, of course, you're welcome to come back.
And the person that asked about receiving the presentation via email, yes, we'll send it out tomorrow.
Great. After I fix my typos, I didn't see any other ones, but I'll just let it go as it is. Hey, thanks you all appreciate you letting me talk to you for an hour, and appreciate your attention always.
Thanks so much. Feel free to email us. Have a great night.
Bye.
Thanks, Marty.
You're welcome.